Hello, my name is Sabita Uthaya. I'm a consultant neonatologist at Chelsea and Westminster Hospital and professor of practice in neonatal medicine at Imperial College London. I'm the chief investigator of the BASE trial. We're shooting this video to help train clinicians who might be seeking consent for babies to participate in BASE. So I'm joined here by Anne-Marie Loder, who is our patient, parent, and public engagement and involvement research fellow in Imperial College London. And Anne-Marie is going to play the role of the mother. So the scenario we have here is that I, as the doctor who's looking after a baby who has just been admitted to the neonatal unit, is here to speak to a mother about the BASE trial. The mother has already received an update on her baby, and I'm about to explain the study to her. Hello there, my name is Sabita Uthaya. I'm one of the doctors looking after your little baby. Congratulations. It's a little boy, I gather. Yes. I know you've already been updated by my colleagues on the neonatal unit. I'm here to talk to you about a study that we are participating in. So the hospital is participating in a few research studies, but I'm here to talk to you about the BASE trial. So the BASE study is looking to study a medication called sodium bicarbonate. You may be familiar with sodium bicarbonate.
What, baking soda?
It is the same compound. However, we use it as a medication to treat a condition called metabolic acidosis. So metabolic acidosis is when there's a buildup of acid levels in the blood. And premature babies can develop metabolic acidosis as a result of various different conditions. We've been using sodium bicarbonate for over 30 years to treat metabolic acidosis. However, until now, no one has really studied the medication to see whether it benefits babies or potentially could be harmful. There are some clinicians and doctors who believe that sodium bicarbonate is beneficial or helps babies because it brings down the level of acid in the blood. But there are other doctors who are worried that it may actually cause harm by affecting the blood flow to the brain and other organs in the body. So what we want to do is study this medication in a systematic way, because there is a lot of uncertainty today in how we should be treating this condition. And so currently, the treatment a baby receives is very much dependent on which doctor is looking after them, rather than a good study that shows that actually sodium bicarbonate is beneficial and potentially not harmful.
Okay, so what will happen with my baby if I take part?
So if you decide to take part, if and when your baby develops metabolic acidosis, we will randomize your baby, and that means that a computer program will decide whether your baby goes into one of two groups. So one group of babies will receive sodium bicarbonate if they develop metabolic acidosis, and the other group will not receive sodium bicarbonate if they develop metabolic acidosis. And the reason we do that is so that at the end of the study, if we see any differences between the two groups, we can put it down to the fact that they either did or didn't receive sodium bicarbonate. We will also collect some information about your baby, and when your baby gets to the age of 2, we're also interested in seeing how babies develop. So whichever group your baby is allocated to, they will still, all other aspects of your baby's care will be down to the doctor treating your baby. And there may be occasions where if your baby is allocated to one or the other arm, the doctors, if your baby is either unwell or the doctor feels strongly that they need to change the type of treatment, then they may do that.
Why will that happen?
So it could be that your baby is very ill and the doctor strongly believes that they must give sodium bicarbonate, and if your baby has been put in the group not to receive sodium bicarbonate, they might choose to do so. Alternatively, the doctor might feel that your baby shouldn't be given. Now, these scenarios are rare, but in the main, babies will be treated according to the group that they've been allocated to.
Okay. But what if I don't want to take part?
So, as I said, it's entirely up to you if you want to participate in the study or not. It'll not affect your baby's care. But so you're aware, even if you choose not to participate, your baby could still either receive or not receive sodium bicarbonate. In that sort of scenario, it'll be very much down to what the doctor feels. And as I said, there are some doctors who feel baby should get it, other doctors feel they shouldn't. And we don't really know the right way. And this study is really formalizing what happens in clinical practice anyway, which is at the moment, as I said, there's so much uncertainty that the treatment your baby receives is then down to the doctor looking after your baby.
Can I decide when my baby develops it, if my baby develops it?
I didn't understand what you meant.
So my baby doesn't have it right now.
Yeah.
So I don't really know how I feel.
I see what you mean. So potentially, yes, you could wait until your baby develops metabolic acidosis. However, because we then have to get the computer program to allocate the group to your baby, it can potentially either delay the treatment that your baby receives, and it may be then we have to have this further conversation with you. So the purpose of having the conversation now is so that we have your permission. However, between now and your baby developing metabolic acidosis, if you feel you want to change your mind, that's absolutely fine.
Okay.
And in fact, even once your baby is in the study and they've been put into one of two groups and they've received the treatment or not received the treatment with sodium bicarbonate, you could, a few weeks down the line, decide to change your mind. And if you do so, that's absolutely fine. You don't need to give us a reason, and you're absolutely within your rights to change your mind at any time.
Okay. And so if I say yes, are there any risks by taking part?
There are no additional risks to your baby from taking part. As I said, both treating and not treating metabolic acidosis with sodium bicarbonate are in current practice in the UK. So, there are babies currently receiving it and there are babies who are not. So there's no change to that. So there is no additional risk to your baby participating. As I said, what we will be doing is collecting some information about you and your baby. We will follow your baby up to the age of 2 years. And there will be a questionnaire at the age of 2 for you to fill out to see how your baby is developing. But no, there are no additional risks to your baby.
And benefits?
So there may not be any benefits to your baby. However, all of the information we gain from the study will help to help us understand how to treat babies in the future. So do you have any further questions?
No, I don't think so.
Okay, what I'll do is I'll leave you this information. There's also a QR code that you can scan, and it takes you to a little video that explains the study in a bit more detail. Have a chat with your partner, and I can come back later and answer any further questions. Or if you decide that you do want to participate, just let one of the doctors or nurses know.
Yeah, I'm happy to take part.
Okay.
Yeah.
So what we'll do is I'll leave that with you.
Thank you.
What we'll do is put a little note on your baby's incubator to say that you're happy to participate. And then when your baby develops, if your baby develops metabolic acidosis, then we will get the computer program to put your baby into one of two groups. And as I said, have a chat with your partner, and if your partner has any further questions, we'd be very happy to come back and answer those.
Okay, thank you.
And just so you're aware, at the end of the study, when we have all the results back, we will write to all the participants and their parents who took part in the study to let them know the outcome of the research study. So that is the end of the training video. This scenario was me explaining the study to a mother who has just delivered a baby, but you could use the same form of words to describe the study to a woman who's in threatened preterm labor. And if at all possible, we should be trying to speak to parents as early as possible so they have enough time to consider the study.